Hello, everybody. How are you all doing? I hope everybody's okay and healthy. I'm not going to talk about Neo or Xpeng. I'm so sick of tired of talking about Chinese electric vehicles. I'm done. I'm going back to my bread and butter, which is biotechs. And that means I will be mispronouncing almost every word, but that's okay, because you all love me for that. So thank you, and I love you too. There is so many biotechs that I'm actually loving this bear market. Excuse me, these things are so good. I'm loving this bear market because everything that was so expensive 2 years ago that I can only get one, let's say Inovio Pharmaceuticals. 2 years ago, I remember I had 1,000 shares at $15 a share, and that was basically like, that was really all I could do. I was putting my eggs all in one basket, basically. But now, with all these biotechs now in the dollar range, or even in the pennies, you could get 1,000 here, 1,000 there, 1,000 there. So, and we know the market's going to go up. So we just have to be patient. And so, yeah, I'm back on biotechs because that's what I like, I guess. No more EV stocks, especially Chinese stocks, and but anyway, let's talk about Verastem. Verastem, I guess that's how it's pronounced. Ticker VSTM. And they specialize in oncology. And let's read a little thing. RAS pathway, examining the most frequently mutated oncogene in human cancers. Almost a third of all cancers in patients are associated with mutations of the RAS family of genes, which include KRAS, NRAS, and HRAS. There are other oncogenes, including EGFR and BRAF, that also activate the RAS pathway, meaning an even higher percentage of cancer depend on this pathway for growth and survival. Patients with a RAS mutated cancer tend to experience worse outcomes and a higher disease burden than those without RAS pathway mutations. What? Their customized Verastems, their customized combinations of VS6766, a unique RAF/MEK clamp, including a combination of defactinib, a selective FAK inhibitor, have the potential to greatly expand the number of effective treatments for cancer patients who have limited options today. So I'm excited about, that's just a little basic little preview of what the company does. I'm excited to get back in all these biotechs because they're so dirt cheap. And I like that. Who doesn't like that? We know all these things are going to go up. But anyway, let's see. They closed on Friday at 85 cents. They closed. And their 1 year target is $5.40. So that's a big leap forward. Their institutional ownership is 60%. That's a lot. Obviously, they're at their 52-week low, right at their 52-week low of 85 cents. Market cap of 159 million. Ratings of outperform, buy. I mean, the stock has been very upgraded. Just another little preview of what they do. A development stage biopharmaceutical company focusing on developing and commercializing drugs for the treatment of cancer. Its product in development includes VS6766, a dual rapidly accelerated fibrosarcoma mutagen activated protein kinase clamp that blocks MEK kinase activity and the ability of RAF to phosphorylate MEK. The company also engages in developing RAMP 201, an adaptive two-part multi-center parallel cohort randomized open-label trial to evaluate the efficacy and safety of VS6766, and in combination with defactinib, an oral small molecule inhibitor of focal adhesion kinase in patients with recurrent low-grade serous ovarian cancer, and RAMP 202, which is in phase 2 trial to evaluate the safety of VS6766 in combination with defactinib in patients with KRAS and BRAF mutant non-small lung cancer, following treatment with a platinum-based regimen and immune checkpoint inhibitor. Verastem has license agreements with Chugai Pharmaceutical for the development, commercialization, and manufacture of products containing VS6766, and Pfizer. They have a collaboration with Pfizer, so that's a big little partner there, to research, develop, manufacture, and commercialize products containing Pfizer's inhibitors of FAK for therapeutic, diagnostic, and prophylactic uses in humans. In addition, it has clinical collaboration agreement with Amgen, another big partner, to evaluate the combination of VS6766 with Amgen's KRAS G12C inhibitor, which is in phase 1/2 trial entitled RAMP 203. I dig it. So reading that, when you look at the VS6766 plus defactinib, they have 7 trials going on for specific tumors, which is, the first one is KRS with LGSOC, which is phase 2, RAMP 202 for NSCLC, which is phase 2, Frame Advance LGSOC, which is in phase 2, Frame Advance KRAS for NSCLC, all variants, phase 2, Advanced Pancreatic Cancer, phase 2, Advanced KRS Endometrioid Cancer, phase 2, Metastatic Uveal Melanoma, also phase 2. Now with VS6766 plus other combinations, they have 3 trials going on for the specific tumors of KRAS and NSCLC, which is phase 2, and the RAMP 203, which we discussed with their partnership with Amgen, and RAMP 204 for NSCLC with CRAS in collaboration with Mirati Therapeutics. So I'm going to be doing more videos, like I said, on these biotechs that have been, maybe you haven't even heard of them, and they have great catalysts and and they're trading so low. So, and that's what I love, biotechs. That's my favorite sector. So that's it. I just want you all to be aware of Verastem Inc., ticker VSTM. And I'll be giving you more throughout the week. And have a blessed and lovely day. All right. Bye, everybody.